Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Sedatives and hypnotics. First, sedatives. Sedatives are the drugs which will relieve anxiety. Sedatives will relieve anxiety and they produce calmness in the patient. So these are the sedatives. Sedatives relieve anxiety in the patient and they produce calmness. Whereas hypnotic are the drugs which produce drowsiness in the patient and they start to sleep and these will help in patients to sleep. So those are hypnotics. Then for sedatives and hypnotics we have benzodiazepines are the most commonly used sedatives and hypnotics. So the uses of sedatives and hypnotics, they are mainly used for number one, they are used to relief of anxiety. Okay, they are used as a component of general anesthesia. We can use, not general anesthesia, they can be used as a component of balanced anesthesia. Then they can be used in cases of chronic insomnia, and also they can be used as a diagnostic aids, or they can be used for the treatment of psychiatry also. We can use these uh, drugs. So these drugs are also used in the treatment of epilepsy, and also in the seizure states also we can use these drugs. Then these drugs are also used for control of ethanol or other sedative hypnotics. For the control of ethanol or other sedative hypnotics also we can use these drugs. Hypnotic withdrawal states. Then we can also use these drugs, can also cause muscle relaxation also. So these drugs can be used as a muscle relaxants, and these drugs can cause sedation and amnesia. So as a result they can be used for several surgical procedures also.
thank you and thank you for watching.